welcome to Unbiased Science.
Where we bring scientific method to the madness.
We're your hosts, Dr. Jess Steier
and Dr. Sarah Scheinman.
And today we're back for another news roundup, science and health news. Y'all love this so much when we did it last time. We really enjoyed it. So we're bringing it back for a part two. Part two. Full disclosure, we're recording on January 30th. I don't know about you, Sarah. I feel like this is the never-ending month of January.
It's always the never-ending, but January has too many days in it, I think.
It feels like January 80th at this point. But when this airs, it'll be, I can't do the calculation in my head, but it'll be the first week in February, just for some context. And some other context, I have the plague in my household. My daughter tested positive for strep. My son tested positive for flu A. I was telling Sarah I was up all night with a really bad sore throat. Thank goodness for modern medicine. I am a bit drugged up right now because the show must go on. So if I'm a
fun one, then
yes, if I'm a little loopy, that's why. All right. Well, Sarah, without any further ado, do you want to jump into your first story?
Yeah, I would love to. So we each took 3. I think, right? We each did 3 this time. Again,
oh,
just
I
like
did
last
5.
Time.
Oh, shoot. Did we do 3? Okay, no, I'll narrow it to 3. I was prepared for 5, but I will narrow to 3. Go.
Wow,
yep.
Overachiever over here.
Yep.
Or maybe I'm an underachiever.
No. You know what it was, Sarah? Remember how I think we talked about this. I used to do the Monday coffee talk with Jess where I ran through news stories, and for those were 5 stories. So I got my wires got crossed. So while you're talking, I'm going to narrow it down to my top 3. So go on.
All right. Sounds good. Okay. So kicking things off with a cheery topic. This article is from the Associated Press, one of my favorites, and it's entitled, it was written on the 13th of January of this month. And it's entitled, Up to 4 in 10 people could develop dementia after 55, what you can do to lower your risk. So my research topic I have mentioned on the podcast before. I work in an Alzheimer's disease lab, so this stuff is very, very familiar to me. And I'm familiar with the study that they're referring to, which is a new study that shows that nearly 1 million Americans a year are expected to develop dementia by 2060. Now, that sounds like a very, very alarming number because it is actually double the current rate. So, but breaking this down a little bit, all this is saying is that if you live long enough past the age of 55, there's an up to 40% chance that you will develop dementia. But there are certain things you can do to mitigate this risk. So I think the first thing that's important to talk about is the difference between dementia and normal aging, because dementia is not an inevitable part of aging. Not everyone who gets older is doomed to get dementia. This is a very important point, and I hope it puts some of your minds at ease. So the way that I usually like to talk to people about the difference between sort of normal cognitive decline as one ages versus dementia is it's extremely normal to forget where you parked your car, forget where you put your keys, or struggle to recall like the last name of a friend. That all is perfectly normal. And it happens to me at age 31, honestly. So there's a very, very distinct difference, though, between forgetting where you put your keys and forgetting what keys are altogether. So that's just a very, very broad strokes example of the difference between normal aging and dementia. So just to define dementia, it is a progressive decline in memory, language, and cognition, and it really is more than just getting older. Now, the most common type of dementia is Alzheimer's disease, which is the disease that I study. It accounts for roughly 80% of all dementia cases. But there are also different types of dementia, like frontotemporal dementia, Lewy body disease. There's something called vascular dementia, which is linked to heart problems and strokes. And all of these make up the different types of dementia. So dementia is sort of like a broad umbrella term, and then you have the different subtypes of dementia. So this article that I'm talking about was in the Associated Press, but the primary source article, the study, was actually published in a scientific journal, and Associated Press is actually summarizing this study. So I usually like to actually go to the study itself when I'm talking about it, and like evaluate that in addition to the secondary source. But just going over a few of the highlights of this study. So it was done in 15,000 older adults, and it found that the risk of dementia significantly rises with age. Now, this is not anything new. We definitely knew this already in the field. From ages 55 to 75, the risk is only about 4%, which is pretty good. By age 85, it jumps to about 20%. And by age 95, it could be as high as 42%. So, really, the title of this article, 4 in 10 people could develop dementia after 55, is really referring to the oldest of the old predominantly. And it's really, it's nothing new. And like I said, dementia is not an inevitable part of aging. It is just something that happens to a small percentage of us, but the risk does get higher with age.
So, Sarah, I was able to track it down. This study was published in the journal Nature Medicine. We will link to the original study. And one of the co-authors was Dr. Joseph Koresh of NYU Langone Health. So folks can go look that up if interested.
Yeah.
Okay,
So
so can I?
sorry,
Yeah.
just a few more things about like lowering your risk of dementia. And we've done a lot of content on this too, including an entire episode about dementia and Alzheimer's disease, which I think was the first episode of this season. But a few things that you can do to help lower your risk is to just control blood pressure, and diabetes and cholesterol, because there's a very distinct link between overall health and brain health. I like to say what's good for your overall health is also good for your brain. And staying socially active is very important later in life and at all points during life. And just making sure that you eat a balanced diet and get plenty of exercise, don't smoke, don't drink to excess. All of these things are important for maintaining a healthy brain throughout life, but especially there's been a link between lower dementia risk and just basically taking good care of yourself.
So, just one thing I wanted to comment on quickly. So, one of the key findings of this was after age 55, people have up to a 4 in 10 chance of eventually developing dementia if they live long enough. And
Right.
I think that that's really interesting because, yes, we are seeing an increase in chronic illnesses, not just dementia, right? Just all kinds of chronic illnesses, cancer, heart disease. And that is due, at least in part, to the fact that we're living longer.
Right.
So we have more of a chance to develop these chronic illnesses. So just wanted to mention that.
No, that's so important, Jess, especially since like when we're talking about really scary statistics like this, 4 in 10 people, and then you hear this very low number of 55 years old, it's alarming. It's alarming. Right. And people will read this and they'll say, oh, I'm going to get dementia when I'm 55. That is not the case. I hope that this is putting people at ease a little bit to hear this from me. It's really not the case. And there are very real things that you can do to mitigate your overall risk, but there is really just a 4% risk between ages 55 and 75. That is very, very small.
All right, so moving on to the next article. This also came from AP News. The title was Meat Without the Animals. So meat cultivated from cells with no need to raise and slaughter an animal is now a reality. But can it be made cheaply enough to displace animal agriculture? So this was a super interesting article. I tried to boil down some of the key takeaways. So over 150 startup companies are currently working on this cultivated meat technology, and the major hubs are in the US, specifically in California, in Israel, and in Singapore. And currently only Singapore and the US have policies that allow the sale of cultivated meat. Now, investments in this technology have tripled on average each year from 2016 to 2022. So this is really a booming focus in the in the science world. There are about 70 traditional meat companies that are involved in this industry. Now, the technology actually originates from the medical world. So it starts with cells that can be sourced from tissue, fertilized eggs, or cell banks. and then the cells are grown in nutrient-rich bioreactors. And it requires what they're calling scaffolding to help the cells organize into proper meat structures. And there are different companies that are focusing on different types of meat. So chicken, lamb, and beef are the three major ones. Now, cost has been a major hurdle, though it is noted in the article that the cost has dropped from hundreds of thousands per burger to about $10. So I'd say that that's a pretty significant, right, decrease in cost. It was interesting. They were talking
about, like we're definitely living in the future here. Like this is some science fiction magic here.
Yeah,
I love it.
For sure. I know, I love it too. They noted, and this makes total sense, that creating structured meats, so like a steak, would be more difficult to produce than ground beef, right? Or ground products, I should say.
Right.
And the most expensive part of the process is that cell food, the growth medium that I discussed previously, which makes sense. I'm sure I see your, nodding. That makes sense to you.
Yes. If to anyone who has ever tried, because what you're doing is you're growing cells in a dish, and that's a scientific process that's called, cell culturing of cells, also sometimes referred to as in vitro. If you hear that, what we're talking about is like growing cells, and cells are very energetically demanding. It needs a lot of good stuff and nutrients in order to grow, because you have all of that baked into your body, but you need to provide that all for the cell externally.
I thought it was interesting. The article notes that there was a survey done of U.S. adults, and public perception is very mixed. So about 50% of American adults said that they would be unlikely to try it, and many who are hesitant cited that it just sounds weird as their main concern. Just a couple of other things quickly. So the scientists are exploring using decellularized vegetables like spinach as scaffolding. Let's see, other things. Creating beef is harder because it's more difficult to make stable cell lines from larger animals. And one company's beef cell line came from a specific Black Angus cow named Lucy. Just maybe a couple of other really quick things, because I think folks might be interested in this. There have been some taste testers who reported positive experiences, particularly with chicken products. Let's see. McKinsey and Company predicts that cultivated meat could provide billions of pounds of the world's meat supply by 2030, but this would only represent about 0.5% of global meat consumption. And let's see, finally, just environmental context. Traditional livestock production is responsible for 10 to 20% of greenhouse gas emissions, and the industry aims to reduce environmental impact, similar to how electric cars are changing the auto industry. I think this is really interesting, obviously from an animal welfare perspective, from food access perspective, environmental perspective. I think that there's a lot of process here, and I think science is freaking amazing.
Jess, would you eat a steak that was cultivated from cells?
I'm so torn. There's a little bit of an ick for me, and I don't know why. I'd like to say yes, I would, and probably with time I would, but there is a little bit of an ick. I don't know. How about you?
Right. No, I agree. I mean, I'm very sensitive to textures when it comes to some of the food that I eat, so like it would really have to... It would have to be fine-tuned in terms of like mimicking the structure of an actual steak or burger or something.
Like, have you ever had an Impossible Burger, which is totally different? It's
a different thing entirely. That's just I think that's mostly like seitan.
It's right. It's like a veggie burger, basically, right? But it's made to taste like meat, right? Yeah.
Yes. Those are very good, actually. I've had those, and they're delicious.
Can I just tell you, for some reason, I have an ick with that. It's so weird. I don't know what it is. I know. So I got to get over this, because I think this is pretty cool. But anyway. All right, Sarah, keep us moving. What's next?
That is so neat. Okay. All right. So the next thing, a little bit less fun, but this is an episode that I read, Scientific American.
An episode? Do you mean an article?
An article? Wow. We're recording an episode. This was an article, written form, long form, Scientific American. Um, entitled "What's in Zyn?" The FDA authorized nicotine pouch. Is it harmful? And this was published on January 24th of this month. And I really learned a lot from this article. So first of all, let's talk about what even is Zyn. So Zyn are they're nicotine pouches, and the FDA recently authorized the use of them, and they were created by a company called Swedish Match, excuse me, and they are marketed as smokeless alternatives to cigarettes. So, what does an FDA authorization mean? This is a really important question when we're talking about something like this. So, authorization means that the pouches can stay on the market. That's all that this means. It does not mean, and this is very important, that they are approved, because they are not approved as fully safe. So, they were theoretically they were authorized because they can help some users switch from traditional tobacco products like cigarettes. And the problem is, though, that Zyn is one of the top selling nicotine pouch brands in the US, and the market is rapidly expanding, but there's a real big concern when it comes to their popularity in young people, amongst young people. And I think, Jess, and I'm not on TikTok, so I'm not fully aware of this trend, but there are something called Zinfluencers,
Oh,
and
yes.
these are young people that are really, pushing the use of Zyn, and there's a lot of concern because Zyn has comes in a variety of fun flavors, and the marketing really appeals to younger users. And in fact, the FDA has issued many warning letters to retailers about the sale of Zyn to underage folks. And how, just so stepping back a little bit, let's just talk about, like, how does Zyn actually work? How do these nicotine, what even is a nicotine pouch? So these pouches contain nicotine salts that you put sort of between your lip, I believe, and your gum. So you just stick it under your lip, and what it is that these nicotine salts and the are then absorbed through the gum and the lip and deliver the nicotine without combustion directly into the bloodstream through the oral mucosa. And while this method does pose fewer harmful chemicals in theory than cigarettes, they still pose risks. So it's really important that we keep this in mind. So this is not, nicotine pouches are not without risks, but they can actually help people to reduce the amount that they're smoking or even quit altogether. And there is more independent research that's needed to confirm potential long-term benefits of Zyn in particular. But there is some risk associated with it. And I think that the use of Zyn really, and nicotine pouches in general, really raises the question of this line that we're walking between, like, the potential benefits as of the use of this type of technology or this type of product as risk mitigation for smoking cessation versus increasing the number of nicotine addicted individuals that would be maybe not picking up a cigarette but are seeing Zinfluencers on TikTok and thinking, oh, I might want to try this for myself.
Girl, I got a lot to say. Can I jump in real
Let's
quick?
go. Yes, please
So
do.
I've mentioned on the pod, my research actually throughout my career has largely focused on tobacco policies, tobacco related policies. I've been watching the tobacco industry very closely for about 2 decades now. And because we've cracked down so much on cigarettes, the tobacco industry has very cleverly looked to alternatives like e-cigarettes and now Zyn
Mm-hmm.
pouches. Sarah, you raised a really great point. And just like e-cigarettes, some smokers have found that these alternatives, these smoke-free alternatives, are quite effective to help them quit. But the problem is that they're marketed to kids. So they're leading kids to initiate this. Nicotine is so highly addictive. So the concern is that, okay, now they're getting hooked on nicotine. Could this be, a gateway to potential smoking? And even if it doesn't, nicotine, and I know you know this, Sarah, so I'm telling you something you know, nicotine itself comes with its own risks. There have been studies, and I'm talking about like without even smoking. We know that nicotine, for example, impedes wound healing. There are other things, like other effects can include localized oral problems such as mouth, throat, soreness, ulcers, coughing, localized gingival recession, impacts on oral, gastrointestinal, cardiovascular health, and unknown effects on the developing brain.
Right.
So, like, we don't know also, like, what the long-term impacts of this are. And it's tricky because whenever we talk about this, like, there are some people who are like, this helped me quit smoking. And that is amazing.
Yeah.
So there are some people who are like, oh, these smoke-free alternatives, maybe they should be offered as a prescription, for example, for people who aren't current smokers. But I don't know. This is very controversial. Sorry, I had to say something.
No, I'm so glad you did, because I knew when I was reading this article, I'm like, I'm sure Jess is gonna have a lot to say on that, because you did your whole dissertation on smoking cessation, correct?
I did, yes. Cigarette warning labels, yes.
Yeah, and just a quick note on just going back to the effect on the developing brain. I mean, it makes a lot of sense because nicotine actually acts on a specific receptor called the nicotinic acetylcholine receptor that's found throughout the body, but specifically in the brain's reward system. And that's why nicotine is so addicting, because the nicotine, it's going and it's interacting directly with these receptors in the brain, and it really we just don't know the effect that it could have on the developing brain, because the reward system is already quite vulnerable during times of cognitive development early on in life. Yep. So, and it's very, so the concern that these types of products are being, marketed specifically to young people, it's very alarming.
So this leads in really nicely. If I could jump into the next article, is that cool? Okay.
Yeah, let's go.
So this next article is also related to this topic, and I had to discuss it. By the way, we have done posts on Zin, which we will link in our show notes, and we've also done a post and a full detailed newsletter on this next topic. So the FDA, the U.S. has just withdrawn the FDA plan to ban menthol cigarettes. This is huge. I have lots to say about this. So basically, the Trump administration has withdrawn a plan to ban menthol cigarettes. Before this withdrawal, it is important to note that the Biden administration also delayed acting on the rule multiple times. So let's just get that out there. This is not a political statement. Right. So just for some context, and I do have lots to say, but I'll try to keep it brief. Menthol cigarettes represent about 1/3 of the U.S. cigarette markets, and the majority of people who smoke menthol cigarettes are African American. This is the cigarette of choice for the African American community, and that is important. I'll get back to that in just a second. So this was all set in motion in 2009 with the Family Smoking Prevention Act. In 2009, the FDA was granted authority to regulate cigarettes, which was huge. This was huge. I remember when it happened. I was an MPH student. I was like, this was amazing. And the very first thing that they did was they banned flavors in cigarettes. But notably, what they excluded was menthol. And a lot of Black advocacy groups were up in arms, again, because of this total, the fact that so many Black Americans are smoking menthol cigarettes. So this has been an issue for, 2000, how many years ago is that? 15, 16 years at this point. This has been an ongoing battle. Menthol is very interesting. So what it does is it actually numbs your throat when you smoke it, and so it allows you to take a deeper inhalation. So people who smoke menthol cigarettes, because they're taking in more nicotine, they tend to be more highly addicted to cigarettes. So there are lots of reasons why menthol is.
Can I ask just a clarifying question? So this is the case specifically with menthol. This doesn't happen with other flavors. Like when they were banning, there were flavored cigarettes, like the flavored Zin packets that we were talking about at one point, but the other flavors don't numb the throat like you were talking about and lead you to be able to consume more nicotine, correct?
Correct. It's something about that cooling effect. If you've ever smoked a menthol cigarette or even chewed menthol gum, right? There's mint
I was thinking
gum.
about the gum.
Exactly. And, in the newsletter that we just wrote, and this is deeply personal to me, I lost my father to COPD, and I myself smoked cigarettes when I was a teenager. I'm going to be real with you. This is something I discussed in the newsletter. And the very first cigarettes that I smoked were menthol cigarettes because I was under some sort of delusion that smoking menthol cigarettes would avoid my breath smelling like cigarettes. It would somehow be minty fresh.
Oh.
Now, there's also a very long history, and we detail this in our newsletter, a lot of predatory marketing. Yet again, we're talking about marketing, specifically menthol cigarettes, specifically to the Black community. So again, there is a real, health equity issue because we're really disproportionately impacting the, Black Americans in the U.S. So this is a big issue. The ban has been withdrawn. A lot of tobacco companies, a lot of Black advocacy groups are really up in arms about this. This is a major setback for tobacco policy.
Well,
yeah,
that's
a bummer.
That's a bummer. No, and it seems like it crosses political lines too.
It does.
I mean, this is just something that no one wants to happen, apparently.
Yep. And I mean, it's unclear. I'm not entirely sure why this happened, to be totally honest with you, and I'm not going to speculate.
Right.
But I will just share. Take this however you will. The ban would have significantly impacted major tobacco companies like Altria and British American Tobacco, potentially costing them billions in annual revenue. We know the tobacco lobby is quite powerful, so perhaps that played a role.
Oh my God. Yes.
Next story, because I'm fired up.
Okay, yes, next story. Wow, but this is also really this next one is also kind of a bummer. We really don't have any very uplifting stories today to share.
The meat one was kind of cool.
The meat one was cool. No, we like the meat one was pretty cool. All right, no, but okay, so switching gears a little bit, this next article, which was published in CNN, but we've seen it in many news. I've seen it in other news outlets too. This article is entitled "2 Dead, Dozens Sickened in Kansas Tuberculosis Outbreak." All right, so what's going on in Kansas right now? There's been a big TB outbreak in the Kansas City area of Kansas. In January 2024 alone, mind you, this was a year ago, there have been 67 active cases and 79 latent cases of tuberculosis, with 2 deaths linked to the outbreak. And a year later, this is still ongoing. So let's talk a little bit about tuberculosis. What is it? So it's a very contagious bacterial respiratory infection, and it spreads when someone with an active infection coughs or speaks. And it does require close, prolonged contact with someone who has an active infection. People with active TB usually develop a persistent cough that lasts more than 3 weeks and is accompanied by other symptoms like chest pain, sometimes coughing up blood, fatigue, weight loss, fever. It's really a nasty infection. But and what's interesting about TB is that people can also have what's called latent TB, where they aren't contagious. But if it turns active, then they can spread the infection. The good news is that TB is treatable, and health departments are actually offering free testing and treatment for anyone who needs it. And the CDC is also helping out with contact tracing and screening to keep it from sort of spreading further and becoming more of an outbreak than it currently is.
Can I just say one quick thing? I'm so sorry. And I had noted to Sarah before we recorded this. So we did do a post on this as well, which we will link in our show notes. And some people pointed out to me that this is actually not a new issue. A lot of these cases were actually reported in January of 2024. But for some reason, this has been picked up by the media. But that does not change the fact that we are definitely seeing an uptick in cases. And this is a public health issue that we should be monitoring closely. Sorry, Sarah, go on.
No, I mean, it's a good point, because I actually hadn't tracked it.
Yeah.
When I was reading this, because you know how like when the year changes, you still in your head, you're like, oh, it's still 2024. Like, so I didn't even track that at first until we were really talking about it before. I was like, oh, this month? Wow. Like that's, no, it was a year ago, but it's still ongoing, which is like a very important point. And also why I think the news media is covering this still.
Mm-hmm. Now, can I say? Oh no, you're still going. Go on. I don't want to interrupt you.
Oh no. I was just gonna say so. What's interesting too about this is like that health officials aren't sure what triggered the outbreak, which is very concerning. But there are, they are public health officials are working hard to track down everyone that's been in contact with an infected person, so that we can, try and prevent new cases. And just a quick note about who's at risk. There are certain groups, as with any infection, there are certain groups that are more likely to be exposed to TB. Think people who travel to countries with higher rates of TB, and those who live in very crowded places like shelters or jails or nursing homes. And as far as the global impact, TB is the world's leading infectious killer, claiming about 1.5 million lives each year. But the good news is that it is preventable and treatable, but it does still remain a huge global health challenge.
Can I just a couple of points?
Please,
I'm going
yes.
through some comments on the post that we did, and there's a microbiologist who follows, and she was saying that it actually looks like the outbreak is MDR TB, which means multi-drug resistant, which makes it even harder to treat, which is concerning. And the other thing I wanted to note is everyone's asking, well, is there a vaccine for this? And why isn't it standard, or is it standard in the US? The answer is yes, there is a vaccine for TB, but it is not commonly used in the US. So the vaccine aimed at preventing TB is called BCG. I'm going to totally butcher the actual pronunciation, Bacille Calmette Guerin. I'm so sorry if someone is listening to this and cringing. But it's BCG. And I actually know about BCG because it is also used as an immunotherapy for bladder cancer. And my father developed bladder cancer at the very end of his life. And that was one of the treatments that was used on him. But there is a reason why it's not used commonly in the US. The primary reason is that the occurrence of tuberculosis is so low that it is thought that the currently available vaccine just wouldn't be useful. It's also noted that the vaccine has limited effectiveness. It's not a highly effective vaccine. There's some data suggesting that the vaccine is just 37% effective against all forms of TB in children under the age of 5 and 42% effective against lung disease in children under the age of 3. There are even studies that suggest that it really isn't effective in teens and adults who have close contact with someone who is infected with TB. It does work better in kids and in adults, so that is worth noting. And there are also, I believe I read in, oh my gosh, I hope I'm not getting this wrong, that the vaccine might actually interfere with testing for TB, and there might be false positives, for example. Please, oh gosh, I hope that I'm not butchering that. I'll verify that and could pop a link in our show notes. But yeah, so that's the reason why we don't use the vaccine. If this ever did become, a larger problem in the US, I'm sure that would be revisited. Perhaps we would vaccinate high-risk populations.
Right.
But just wanted to note that.
Or people that are traveling to areas where there's a higher incidence of TB.
Yep.
Or people with potential exposures.
Yep. Absolutely. All right, I have another sort of depressing story, but I have to talk about it.
Kinda...
Womp womp. Yeah, January's been a real dud, let me tell you. All right, so this next article came from WAPO, Washington Post. The title was Rare Bird Flu Strain Found in California Raises Potential of Wider Spread. Sorry, my daughter just sat down next to me. I'm recording, honey. All right, so let's just recap. We all know that the U.S. is dealing with a growing H5N1 bird flu, avian flu outbreak, right? We know that the strain has been spreading in poultry farms across the country. Notably, H5N1 has infected dairy cows for the first time. Human cases have been sporadic and have mainly occurred among dairy workers exposed to sick animals. However, there's a new strain, and you never want to hear this, right? In epidemiology, this is not good news. So there's a newly discovered H5N9 strain, which is a direct result of H5N1's evolution. It was
Hmm.
created through something called reassortment when the H5N1 virus exchanged genetic material with other flu strains. Now, both H5N1 and H5N9 were found at this duck farm in November. And I'll get into what the immediate, well, actually, no, I'll jump into the immediate response was that the facility was quarantined. Unfortunately, 120,000 birds were culled, and the farm must be cleaned and tested before resuming operations. So, why are we talking about this? Why are scientists concerned? So, the presence of H5N1 alongside seasonal flu and other strains creates opportunities for new viral variants. Now, previous bird flu pandemics have started through this kind of genetic reassortment. Not trying to sound alarmist, but this is laying the groundwork for what could become a major problem. So in the article, they quoted a virologist, Dr. Angela Rasmussen, who explained with enough H5 in these animals and enough seasonal flu in humans, you have a recipe for a potential pandemic virus. H5N1 is already widespread in U.S. poultry and now dairy cows. The emergence of H5N9 through reassortment suggests that the virus is actively evolving, and this increases the chances of further genetic changes that could make the virus more transmissible to humans. So this is something that epidemiologists and other scientists are tracking very, very closely. This is not good news.
Has the new strain been reported in humans yet?
I have not seen that. I don't believe so. I don't believe so. I
Okay.
think it was just detected in poultry.
Okay.
And I'm
But
sorry
that's
that
the
I
first
should know
step
that.
anyway. No, that's
Yeah.
okay. I just
I'm going to hyperlink. Actually, Emory Rollins School of Public Health did a fantastic post on this where they get a little bit more granular. They actually get into like what the H and the N mean, and like how reassortment happens, just like from an immunology, bio perspective. So if folks want that, we'll
yeah.
definitely link to that. They had an interesting statistic here. So let me just say, okay. So, real quick, 40 humans with exposure to dairy cows have been infected, but we're talking about H5N1. We're not talking
Okay.
about H.
The
Yeah,
original strain.
exactly. The original strain.
Okay.
Their symptoms have been generally mild. Overall, there have been 67 recorded H5N1 infections in humans in the US as of January 28th, 2025.
Okay.
Prior to the outbreak in dairy cattle, bird flu infections in humans had been relatively rare but severe, killing over half of the roughly 900 cases that had been recorded in the last 27 years. This translates to a CFR, which is case fatality rate, of over 50%. And that sounds really scary, but it is important to note that this is likely an overestimation because mild cases that do not require hospitalization would have not been recorded. So it's going to skew the CFR.
Right.
And then, sorry, just a couple more quick things. In January 2025, the US reported its first human death due to bird flu. Again, we're talking about H5N1. This was in Louisiana, in a person who had become severely ill after being exposed to an infected backyard flock of birds that had mixed with wild birds. Okay, I'm just looking if there's anything else. As of January 28th, 2025, over 147 million poultry have been affected in the
Oof.
US. I mean, this is not great. Honestly, I'm looking here.
Not a good time to
H5N9,
be a bird.
no. H5N9 has been documented before, and it is not a threat to humans. So that's your answer. But
Okay, good.
again, the discovery highlights the importance of limiting the virus's opportunities for infection to avoid this reassortment.
Yeah.
Woof. Woof, Sarah.
Ooh, a lot of things. A lot of
A lot
things
of
here in
things.
January to be concerned about.
Yeah. Let's hope February brings some better news.
You know what?
All
I
right.
will say
Yeah.
though that at least for me, I think just at least understanding what's happening here and why I think it's so important to do deep dives into the news coverage, at least for me, is knowing that like things aren't always as they would seem to be presented in the actual headlines of an article, right? Like so,
Mm-hmm.
you know, I think we've I think we've shown today that it's really important to, look at the actual content of an article. Don't just read the headlines and jump to conclusions. And it's oftentimes there's things are a little more manageable than they might be presented in the media sometimes.
Look at Sarah finding some silver lining.
I'm just trying not to make it all doom and gloom because, like, honestly, a lot of times, I mean, I'm not a journalist, but I would assume, the article headlines are generated so that people will click on them. So they would make it try and seem a little more alarmist than things actually are in reality.
Sarah, this is the story of my life. This is actually one of the main goals of Unbiased Science, is to provide that nuance. And yes, like, you're totally right. Headlines are designed to get people to click, right? Clickbait, we know that term. And so things tend to be oversimplified to get those clicks. So we are here for that nuance.
Yeah, keep tuning in. I mean, that's why we're here, guys. In other words, you don't have to do this alone. We're here. We're here with you.
We are here with you. All right, Sarah, take us home.
On that note, thank you all for tuning in. We hope you learned a thing or two. Please join us next week on your trusted source for no nonsense, just science.